Peroxide, I'm cracking them. Okay, second check, saline, peroxide. Got my kit. He's already on oxygen. I'm going to do blow-by. Mr. Smith, we're going to clean your stoma there. And I'm going to clean your inner cannula. Remove the old dressing. Want to kind of assess the site. Old dressing in your glove. Of course, if it's bloody, we want to use a red bag. Should not be bloody. We're going to try and keep the covers, so just fold it over if you have the honor of a new package. Now with this kit, the gloves are right there. So I don't have a choice but to put my gloves on. And this is one of the parts where some of the variation occurs. I don't really want to do it this way, but I'm going to because it'll be easier for you guys. Not real sure which side is the thumb. Sometimes getting a new kit is not the best thing. Now, this is a what do you call it? Waterproof. Okay. It is actually meant for his chest. Okay. I know I just suctioned, so I'm hoping not to have goobers fly out on his gown. And I would rather take the chance of using this for my sterile field rather than that little box, because that's the only other thing I have. Okay. So rather than putting it on his chest, if you choose to put it on his chest, you cannot cover your blow-by, or he won't get any O2. Okay, I'm going to go this way, and notice I'm not crossing over. Okay, if I did it the other way, it would be so long. There's too much room for error. Put this in my vicinity. I'm both sterile. I'm going to take everything out. I'm going to put it here. Okay. This is not the best kit, but it's what we got. Okay. There is one large component to the tray and two very small. There is not a large, medium, and small. The two very small will not accommodate my trach inner cannula to rinse. So I'm going to have to actually hold my saline and do what we call an active rinse. Okay? But in the meantime, I'm going to use my non-dominant hand and I'm going to pour my liquids in there. Okay, so non-dominant hand is now touching peroxide. Caps go up on the table. Don't use your other hand to hold the bottle before it spills. Hydrogen peroxide. Lip it. Hydrogen peroxide. Pour it. Most hospitals now, because we know how potent peroxide is, have us do a half saline, half peroxide. Okay, so I'm actually going to put my saline in the same container. Almost saline, lip, almost saline. So I'm going to pour equal amounts. Now, I told you I need to do an active rinse, so I'm going to have to leave the saline. Actually, I'm going to pour some straight saline into one of these for when we get to the gauze part. I have to do an active rinse for the inner cannula, but not necessarily the stoma part. Okay, so this is dirty. Non-dominant's dirty. Sterile. This thing sticks to everything, so be very careful. I'm not going to use it, but I'm going to set it aside. Because if I drop anything, I may have to use it. Here is my pipe cleaner. I'm going to use my pipe cleaner. I'm actually going to give it a little angle, so I will have a little holder. I'll put my pipe cleaner in my peroxide mixture. I'll put the second one in, depending on how dirty it is. When you test, it won't be that dirty, okay? So you may not need all of it. This kit gives me 2 pipe cleaners, or excuse me, Q-tips. I want one in my peroxide mixture. This is waterproof, so I'm actually going to place things on this field. I want one in my saline. So I'm doing my peroxide closest to the patient because they both are clear on the Q-tip and I don't want to get them backwards. Still going through my package here. I kind of wished that I had done my separating when I had 2 gloves, but I didn't. This is your twill tape that can be used for holding the faceplate in place. We use Velcro holder to make it easier. Still sterile. Elbows at my side. Here's your trach dressing. That's the last thing I'm going to need. I'm going to go around my field and put it back here. Notice I can't go across my field. Remember, my germs will fall. Now, this kit gives me 4 4x4 gauze. So I'm going to use 1 in the peroxide. I'm actually going to use, since they gave me 4, I can use 2. All right, but I will show you how to use 1 if you only get 3. Most cases only give you 3. 1 for peroxide, 1 for saline, 1 for, I'm going to do 3. I don't want you to be in a luxurious world because you probably won't have that pleasure. Okay, we'll do the second one in the saline. So we're going to clean the stoma with peroxide. I'll show you how to rotate the gauze. Then we're going to rinse the stoma with saline. Again, we'll have to rotate the gauze. And so that will leave me with an extra gauze. It leaves me actually with 2 extra. If I wanted to dry, fine. If not, I could use 2 for cleaning, 2 for drying, or 2 for rinsing. Or I can just use them in case I mess something else up. Okay? So I have everything prepared on my sterile field to go. So here's my cleaning, here's my rinsing, there's my dressing. I have this still cracked, so it'll be easy for me to rinse it. I've got my cleaning supplies in there. So I'm ready for the trach inner cannula. So with my non-sterile hand, because remember it's sticking out, so non-sterile hand will untwist, lefty-loosey. Lefty-loosey untwists. So we're going to unlock and remove. Now, the part that I am touching is what? That is less sterile than the part that's in his lungs. So do I want this hand that touched these bottles to touch down here?
No.
Not at all. Okay? So I'm going to put this in the container. And you know you've heard about 6 inches above to hover over sterile fields. Well, let me tell you, if you do 6 inches above, it'll flop out. You'll be dragging it out of the floor. Okay, so place it carefully. Otherwise, it will hit and bounce.
That's in the peroxide?
It's in a peroxide mixture. It's a half and half. That's my only big container. Okay, so I'm going to let it kind of, soak a couple seconds, though. Because what's happening over here? If he's coughing, what's happening? Okay, he's breathing, remember? He has the outer tube. It's not coming out because it's Velcroed in, and I made sure that it was secure. But if he coughs, what's happening to those secretions? They're on the inside of my outer cannula. Can I take that out and clean it? No. Okay, so I don't want to do anything else. I'm focusing on this. Okay, so sterile. Sterile's going to take my pipe cleaner, and I'm actually going to go ahead and take both of them out. So sterile is going to take my pipe cleaner. But now that it's in peroxide, I need to hold the inner cannula with which hand? Sterile. So I need to take this with my holder, and I'm going to pass it on into my non-sterile. Okay, so that's why I made that little hook. So my non-sterile hand will be the one that's cleaning the inside. So sterile. What part of the inner cannula am I going to grab? The sterile part. Because my gloves are sterile, right? I know that other piece, not quite so sterile. Do I want these not quite so sterile? No, I want this sterile. So I will now, and forever forward, only touch this part with sterile. So I'll go in and clean. Shaping itself. So here's what happened. The nurses were putting pipe cleaners here. It's a very flimsy plastic. It was causing it to crack. Okay, so you really shouldn't have to go through both ends. Okay, one end. Now, there could be stuff on the outside. Probably it came off with the saline, or saline and peroxide. But this here, this piece here that goes in the crack, that doesn't come out too readily. So, want to make sure you get that. So what's on this? Peroxide and saline. Mm-hmm. So what do I got to do? Rinse. Non-dominant hand. Take my saline bottle. This is what we call an active rinse. That means we're not just throwing it in the basin. We're actually second check lips, third check pour. Pour. Oopsie. So you would be pretty liberal with your pouring though, okay? Because you want to make sure it goes not only down the middle, but also around the sides. Wasn't supposed to really get wet, but sterile to sterile. Drop it in. Sterile to sterile. Now, I actually touched this to what? The bottles. So which would be the safer one for me to lock it in with? Your sterile. You understand that? This is the better of the evils. Once we get to cleaning the stoma, that's in their lung. The stoma's outside. Okay, so your most sterile is that piece there. So that's why that was our focus. So now we're going to clean the stoma. So I have one piece of gauze. This is still sterile. I touched the outside of that. What was on the outside of that? Huh? Yeah. Saline, peroxide. It's as clean as I can get it, right? But if there's any germs on it, what germs are they? His. So can I now do the stoma with sterile gloves that may have his germs that were in his lungs, and now I'm outside? Absolutely. Okay, so remember when we do sterile in med-surg units, we are sterile by the purpose of I am not introducing germs into my patient from a neighbor, for example. Okay, now in the OR, they're all sterile. So to do sterile in the OR is very easy. Med-surg, not so much. Okay, so we reinserted it, but if there are any germs, they are germs that he already has. So you can't give him an infection if he already has one. You can give him another one, but the same one. So now we got our peroxide. Okay, and I'm basically going to do the rounded corner. And you can start up top or down bottom. Basically what you're going to do is wipe across the top. You're going to rotate your gauze, wipe across the bottom. Okay, so your book talks about a 2-inch circumference. When you take a 4x4 and fold it in fours, it's 1 inch each. 1 inch around the top, rotate, 1 inch down the bottom. That's your 2-inch circumference. Now, in order to get there, you need to take your non-sterile hand and move very carefully the faceplate. Okay, we need to move it out of the way. So we'll start at 3 o'clock, moving the faceplate out of the way, covering 1 inch, go to 9 o'clock, out. Now I need to rotate. I don't want to take germs from under and put them on top. Across the top from 9 to 3 and discard. Now that was peroxide. Okay, so that's my clean. What did you notice when I was having my hands there? Tried not to touch the faceplate. Was I able to not touch the faceplate? Chances are you're going to have to touch the faceplate. The faceplate may have some really yucky stuff underneath. You may have to really work at this here. Okay, we're doing a fairly clean individual here. Okay, that is why my inner cannula is in the patient now. So you understand, you don't want to do the stoma care until the inner cannula is completely cleaned and replaced. Because when you get to stoma care, you're talking germs that are outside the patient's body, and we don't want to put them inside. So now we do the same exact thing with saline. Go across 3 o'clock to 9 o'clock on the bottom, rotate the gauze. 9 o'clock to 3 o'clock across the top. That was my saline. Now, I did forget to do my peroxide. It doesn't really matter if it's before or after. I typically do the peroxide on the top faceplate here. Okay, so start at 12 o'clock, 1 loop around. Okay, that's my peroxide. Nice. You guys can't see what happened here. My Q-tip, when I went to grab it, flew off the peel. So, yeah. I have an extra gauze. And I also have that hook. I'm thinking of using that pipe cleaner hook thing. No, because that has peroxide on it. Shoot. Okay, got to use my gauze. So, here's sterile. I'm going to just fold it up pretty. I want just a little corner to replace my Q-tip that I contaminated. I need saline on it now. Actually, I have saline in here, don't I? Mm-hmm. So, squeeze out. Have to make do. Once across the top. Oh, that was perfect. Okay, non-sterile, sterile, done. I actually could have gone across the field by now, huh?
See how it sticks?
Man, this pipe cleaner. Don't want my hands sterile, right? Can't have non-sterile over. It has to only be under. All right. Now this is applied as a sterile piece of gauze, but again, chances of you being able to get it under there without your hand touching anything is pretty slim. So we want to stay on one side. This side is all sterile. Basically, you're going to put your 2 fingers on the wings and use that to try and go underneath. Okay, so I'm going to have to angle my faceplate again with my non-dominant. Use that to push my wings up and underneath. Now I'm trying not to use this one yet. Try and get as much up there as I can. And so at this point, truly, I'm done. My hands probably are not that dirty, so I'm going to use this to reconnect their O2. If your hands were kind of yucky from the stoma, then please put on new second pair of clean gloves, clean gloves. So we'll go ahead and reapply this. If Mr. Smith could move his head, life would be much easier. And there's that. Put this off. This goes off.